Hello guys, welcome back to another video. In case you're watching this video for the first time, kindly subscribe and like video, share, comment, and you should subscribe and you should watch this video up to the end, because this is the channel that we make learning easy and accessible for everyone at the comfort of their zone. So today's topic, we are going to talk about infertility. And infertility, we are going to talk about both in male and female. So what I want to say before I go specifically to infertility as a topic. Infertility in our African tradition was seen as a curse in the family. Any couples or any people who did not have children, or like they expected when you get married you are supposed to get a child, or you are supposed to get pregnant immediately after marriage. And therefore, if by any chance or by something just happened and you happen not to get pregnant immediately, they would consider you as a cursed person in that family. And also they will say that maybe you did something wrong, that is why God cannot give you a child. And mostly they were focusing their problem. They were saying that women are the people who are not able to produce children in that family. Women are the people who are blamed of not giving birth in that family. And in this case, we see that infertility can happen to both male and female. Male, we have some factors that can make them to be infertile, and also we have some factors in female that can make them to become infertile. And therefore, if you are dealing with a person or with couple who are having a problem of infertility, you have to treat both of these people. You have to look into consideration of these people, each and every person, and see where could this case come from, where is the problem coming from. Maybe the woman is okay and the man is the one who is having problem. Maybe the man is the one, the woman is the one with the problem, and they are blaming each other. So when you are dealing with a case of infertility, you have to look at both partners. So if you know you have not subscribed, kindly subscribe to this channel, like my video, share, comment, tell me what you want to talk about, and we will make learning easy and accessible for you at the comfort of your zone. So these are some of the key factors when you're looking at infertility. Let us first define infertility. Infertility is a disease of male and female reproductive system, defined by the failure to achieve pregnancy after 12 months or 1 year of having unprotected sex regularly. Yeah, that is what we call infertility. Failure to achieve pregnancy after 12 months of having unprotected sex regularly or each and every day. Infertility affects millions of people of reproductive age worldwide, and has it has an effect to people. It can cause psychological effect, it can cause emotional effect, it can cause economical effect. And those who are suffering from infertility, they know how sometimes it's really affect the entire person or the entire family. So in male reproductive system, infertility is mostly commonly caused by problem in the ejection of sperms, maybe the absence or low sperms, what we call oligospermatozoa, level of sperms, and also or maybe the abnormal shape of sperm, or maybe the sperm having a problem with motility or movement of the sperm. And in female reproductive system, infertility may be caused by a range of abnormality in ovary, in the uterus, fallopian tube, and in the endocrine system. So infertility we have two types. We have primary and secondary infertility. So primary, the woman has not, or the couple, let me talk about the couple, has not ever had a child. Secondary infertility is when this person has ever had a child in the previous day, and right now he is trying to get pregnant and they cannot get pregnant. That is when we have secondary infertility. Most cases we cannot be sure of the cause of infertility, and also in most cases this problem can be treated if you start at seeking health treatment at an early stage. So infertility can be caused by a number of different factors in either in male or female reproductive system. However, it's sometimes not possible to explain the cause of this infertility. So let us look at the causes of infertility in female first. We are going to look at the causes of infertility in female, and then we will be looking at the causes of infertility in male. So in female reproductive system, infertility can be caused by tubal disorder such as blockage of the fallopian tube, and you know that the fallopian tube is where fertilization, along the fallopian tube is where fertilization takes place. So if there is blockage and the sperms cannot pass through to meet the ovum, then this woman can suffer infertility. And some of them, they can be blocked, can be unblocked. Some causes can be unblocked and some may not be unblocked. And this tubal blockage can be caused by maybe if this person had STI, sexual transmitted infection, or maybe complication from unsafe abortion, or maybe if this person maybe had postpartum sepsis or abnormal pelvic surgery. This person can suffer a blockage and that of the fallopian tube, and that one will be the first cause of infertility in female. The second one is about uterine disorder, which could be inflammatory in the nature, maybe because of the congenital in nature. Maybe somebody was born with a uterus which is not normal, and also maybe if this person having a benign or maybe tumor, or maybe the fibroid, or maybe this person is having fibroid. If you are having fibroid, sometimes you can have hard time with conceiving, and therefore you can suffer infertility. The second point is about the disorder of the ovaries, such as the polycystic ovarian syndrome and other follicular disorder, or maybe if you have some condition related to ovary, you can also suffer infertility, because you know the ovary is where the ovum usually come from, so that it can be fertilized in the fallopian tube. And if you have a disorder or something that is making it not to be removed from the making the ovum to be expelled from the ovary, then you will suffer infertility. And also we have another factor, which is the endocrine system, causing the imbalance of the reproductive hormone, that is the progesterone and estrogen. Those are the hormones that are responsible for ovulation, and when you're ovulating is when you're fertile, and then you can get pregnant at that time. If these hormones are imbalanced, sometimes getting pregnant can be a problem. And also maybe if you are having a problem with the pituitary gland, if you're having a problem with pituitary gland, maybe a tumor or a cancer in the pituitary gland, or maybe in the hypothalamus. These are the control system of the body or of the endocrine system, and therefore if you are having a problem with those, the pituitary gland, the hypothalamus, then you will not be able to conceive. Those are the causes of reproductive system in male. In female, yes, in female, if you're having a problem in the uterus, in the fallopian tube, in the ovary, and in the endocrine system, then you will have a problem with conceiving. So treating this person will depend on which the person is suffering, which site is the problem is coming from. If this person is suffering from fibroid, then the fibroid has to be eliminated so that this person can get pregnant. If this person is having maybe the problem with the ovary, then the gynecologist will see what to do on the problem, and then this person will get pregnant. Most of this problem can be treated, and therefore if you are having a problem with conceiving, don't hesitate to go and see your gynecologist. So let's look at the causes of infertility in male, because you see that when there is infertility in a family, the woman usually is the person who suffer. A woman is the one who will suffer most, because they will see maybe this, they will say this person maybe did some abortion or something else. Even if you don't know what is called abortion, they will always blame you about not getting pregnant, and maybe the male person is the one having problems. So let us look at some of the causes of infertility in male. Yeah. So the first cause of infertility in male is the obstruction of the reproductive tract, causing the dysfunctionality in the ejection of the semen. This blockage can occur in tubes that carry the semen, and the blockage are commonly due to the injury on the infection of the genitalia. Maybe if this person had STI and was not treated at the right time, and then the complications set in, and therefore there is a blockage, and you see the sperms cannot be transported to where it's supposed to be, and therefore you will suffer from infertility. So maybe you are a man and you are blaming your woman about not getting pregnant, and maybe you are the person who is having a problem with the transportation of sperm, because there is a blockage along the urethra. So the second cause is the hormonal disorder leading to abnormality in hormone produced by the pituitary gland, and also hypothalamus, and also the testicle. Hormones such as testosterone regulate sperm production. So example of disorder that result in hormonal imbalance include the pituitary and testicular cancer. If you have a testicle cancer, and maybe you have a tumor in the pituitary gland, therefore the testosterone hormone will not be produced enough to regulate the production of sperms, and therefore maybe you can have oligospermatozoa, or maybe low sperm count, or maybe you can have an absence of sperms. So testicular failure, another cause is maybe testicular failure to produce sperms. Maybe if for example, due to varicose cells, or medical treatment that impaired the sperm production, can cause a problem with the testicle, and then you cannot produce sperms that can impregnate a woman. That is the third cause. The fourth cause maybe is the abnormal sperms function and quality. If maybe you are producing abnormal sperms, and then therefore abnormal sperms mean that the shape of sperms is not correct, the movement of sperms is not correct, and also maybe the sperms is not mature enough to fertilize an ovum. Yeah, then both of you will suffer infertility. So both male and female there are some other factors that can cause infertility, such as environmental factors such as smoking, excessive alcohol intake, obesity can affect infertility. In addition, exposure to environmental toxic or pollutant can also injure the eggs, the sperms, and the ovum, and therefore it will lead to infertility. So let us look about the risk factors for infertility. So who is at risk of getting infertility, or which group of people are likely to suffer infertility? So these are the group of people who are likely to suffer infertility. For women age over 35 years, sometimes they usually have a problem with conceiving. And also for men, we have age above 40. Sometimes can have problem with infertility. And also we have those who are suffering from diabetes. Both male and female can suffer infertility because the excess glucose in the blood can damage the blood vessels that are responsible for this chronic illness. Sometimes they damage the whole body system, and therefore maybe getting pregnant can be sometimes difficult. So those who are having eating disorder, which maybe if you are having anorexia, you can also suffer infertility. Excessive use of alcohol and smoking can put one at risk of suffering infertility. Exposure to toxic substances such as lead and pesticides most also can suffer infertility. And another group of people of over exercising also can make someone suffer infertility. Radiation therapy, if you are having cancer and you are undergoing radiation therapy, sometimes you can suffer infertility because it denatures the normal cells in your body, and therefore infertility will set in. If you have ever suffered from sexual transmitted infection, you are likely also to suffer from infertility because they damage the reproductive system of male and female. I had already talked about how these things happen if you have STI. So if you have not watched the previous video about STIs, I've not finished even the episodes or the parts of all the diseases about the STIs. And if you have not watched the one that I've uploaded, kindly go and do so because you are missing a lot. So stress can also make one suffer from infertility, and also obesity. If you're obese, you can also suffer from infertility. Women with abnormal menstruation can also suffer infertility. I already talked about those women with also kidney diseases. Both men and women with kidney diseases can also suffer infertility. If you have had previous ectopic pregnancy, you can also suffer infertility. Women with PID, pelvic inflammatory diseases, can also suffer infertility. Polycystic diseases can also make someone to suffer from infertility. And also, if you are having a cancer of the reproductive system, you can also suffer infertility. There are so many causes or risk factors about infertilities, and I think I've exhausted. If you think that I've left one or two, maybe you can add them in the comment section. I think that was it for today, and thank you for being with me. Thank you for watching this video. Make sure we meet in the next video. Bye.